Part 2 of urinary system drugs. Overactive bladder is a condition characterized by frequency and urgency. In other words, the patient has to go a lot, and before they have to go, they don't even get a warning. All of a sudden, they just gotta go. So they're running to the toilet. Why is this a problem? Because we want our patients to not have accidents. It's very debilitating. It means maybe they're not leaving the house because they're worried they're going to have an accident. It can cause a lot of psychological results, consequences as well. So we want to help these people maintain control of their bladder. Frequency is defined as having to urinate more than 8 times in 24 hours. Urgency means a sudden need to urinate. We covered that. Antispasmodics, which are anticholinergic in action, meaning they block the parasympathetic nerve impulses, are used to increase the capacity and decrease the urgency of the urinary bladder. When you learn about anticholinergics, I don't think we've covered it yet necessarily, or if we have, it will be very shortly. You will learn that anticholinergics sort of dry everything up and stop it from moving. So when we think about wanting people not to have to urinate all the time, drying them up and stopping things from moving along, stopping spasms is a good thing. So these drugs are used for the relief of urgency, frequency, peeing in the middle of the night, and incontinence. They have similar adverse side effects, especially in older adults. Some drugs that you might see used commonly. Where did it go? Good Lord, that thing. So ditropan, Detrol, Oxytrol, Enablex, Vesicare, they all have different generic names. I don't know why they didn't list them here. It's kind of frustrating. But those are all medications used for overactive bladder. If you go back to table 15.2, the generic names we're looking at, tolterodine, oxybutynin, darafenicin, etc., are all listed in table 15.2 with some dosages. Another great place to pull your drug information project drugs from. We're learning about them, you might as well fill them into a table. Side effects of the anticholinergics that are used for treatment of urinary frequency or overactive bladder include drying of all secretions. This is usually a good thing for somebody who's peeing too much. However, it can be annoying if your eyes are dry, your mouth is dry, so keep that in mind. Drowsiness, dizziness. This is especially a problem in the elderly. Urinary retention and constipation, blurred vision, mental confusion, again, especially a problem in the elderly. Tachycardia, nausea, vomiting, rash, and hives. Precautions. If I have to say it one more time, I hope you'll get it. The elderly. Let's be careful in the elderly with these drugs. We want to keep an eye on them and make sure that they're dealing with the side effects well. You know, they're not being left on their own to possibly have a fall or go out and drive and be dizzy and tired. The rest of the list of side effects is also important, but really we're most concerned with older adults and of course our patients with glaucoma. Cholinergics. This is the extreme opposite side of it. This is for somebody who's having difficulty urinating. Bethanechol is a cholinergic drug that stimulates parasympathetic nerves to bring about the contraction of the urinary bladder. Most often, people have trouble urinating either after a major accident, major trauma, post-operatively, or postpartum. So this helps them go to the bathroom. Side effects are cholinergic in action, so different, extreme opposite from our bladder antispasmodics. GI cramping, diarrhea, nausea, vomiting, sweating, salivation, headache, slow heartbeat, urinary urgency. So again, keep in mind, these are going to get everything moving again. Precautions: if somebody had a GI tract obstruction, we wouldn't want to start moving things along, because all you're going to do is put pressure on that block. Hyperthyroidism, peptic ulcer, and IBS, asthma, cardiovascular disease, especially somebody who has a slow heartbeat already, Parkinsonism, and pregnancy and lactation. Urinary analgesics. Phenazopyridine is a urinary analgesic or local anesthetic used very often for urinary tract infections. UTIs can be painful when people have to go to the bathroom, literally doubled over in pain. If you haven't had one, you're lucky. They're awful. So phenazopyridine will not treat the infection, but it will get rid of the symptoms temporarily. The fun thing about phenazopyridine is it turns everything orange. It turns your spit, your eye juice, everything is orange. Your sweat, your urine. So patients will often take this medication, and if they haven't been properly warned, they come back to us and they're like, oh my god, something's wrong, everything is orange. Nothing's wrong, the pill is working, and they're probably back not doubled over in pain, which is good. It's used only for symptomatic relief while waiting to see a physician to treat the infection. Side effects can include headache or vertigo, mild GI disturbances, discoloration of body fluids. Keep in mind that may stain contact lenses, fabric that people are wearing, etc. Most annoying sound in the whole wide world. Hopefully it ends soon. BPH, this is I think our last section. BPH is a problem that affects males. They have a prostate. It can become inflamed or develop hyperplasia as they get older. And it's painful. It involves the inability to go to the bathroom. There's a lot of problems that come along with this. So, drugs that are used to treat the symptoms of BPH include those that slow prostate growth, such as the anti-androgens, those that relax the bladder smooth muscle, making it easier for urine to flow from the bladder, which are called alpha blockers. Oftentimes, patients might also get surgery to remove parts of the prostate, but really that can be life-altering for their sex life, unfortunately. So usually we try to treat it medically before we go chopping into them. Anti-androgens include finasteride and dutasteride. They work by suppressing prostate growth, and associated urinary obstruction and manifestations are also then relieved because the prostate exists as a little ball around the urethra. So if it gets bigger, it squeezes the urethra, nobody can go to the bathroom. They're usually administered for a minimum of 6 to 12 months. And again, this therapy is more suppressive. It doesn't cure the problem. It just helps with the symptoms. Return of hyperplasia is likely if the drug is withdrawn. So it keeps the prostate right where it's at. It doesn't grow anymore, meaning the patient doesn't develop further problems. Side effects can include impotence, decreased libido, decreased ejaculate, and gynecomastia, that nasty little problem of breast tenderness and enlargement. Side effects diminish after the first year of treatment. We want to be cautious in patients. They should be screened for cancer first, as well as infection and other urinary dysfunctions. So, let's see, moving on. I'm not going to cover saw palmetto. It's an herbal medication that is used frequently to treat BPH. It might moderately reduce symptoms, however, the effects aren't always known, and it's not as well studied as these medications. Alpha blockers. Remember, these are the ones that make it easier for urine to flow from the bladder to the urethra. Alpha blockers include tamsulosin, doxazosin. There's a number of alpha blockers. They block alpha-1 receptors in the smooth muscle in the bladder, neck, and prostate, causing them to relax, making it easier for urine to flow through. They're considered to be first-line therapy in the treatment of BPH. And side effects include dizziness, headache, nasal congestion, orthostatic hypotension, that's a big one, palpitations, as well as some issues with libido, ejaculation dysfunction, etc. So if patients have a history of sulfonamide allergy, they wouldn't want to take Flomax. And again, interactions. But really the big one with this is orthostatic hypotension. Again, these can decrease the blood pressure, so when a patient stands up, they get dizzy and might fall down, so they need to be warned to get up slowly. Phosphodiesterase inhibitors are all infamous Cialis, used to treat erectile dysfunction, can also be used to treat the signs and symptoms of BPH. Not commonly, I haven't seen it used a whole lot. The book doesn't cover it very much in detail. So we are done with this chapter. So you are done listening to that annoying sound. I'm going to go fold some laundry, and I'll talk to you guys soon.